everything might not be fun.
The politicians keep saying, why is our healthcare system so expensive? And like, duh.
How does that make any sense?
We'll figure it out. This is the thing, I'm just getting totally unhinged now, and I don't know what to do. Hey, so we're back in Patapsco, and it's a beautiful day here. And I wanted to talk about something called medical reversals. Medical reversals, I read this great book about medical reversals, and I'll give you the information about the book. And medical reversals are something that you used to think are true, and now you find out they're not true. I mean, we all deal with this every day. We hear about it on the news, we read about it, and we hear, wow, they used to say calcium, everybody should take calcium. Now they say don't take calcium, it's gonna hurt you. One after another, you hear this. One year, a certain vitamin is the greatest vitamin in the world. The next year, they tell you it actually could hurt you. Folic acid has gone through that. So this book talks about medical reversals and how they happen. And probably the biggest example of medical reversals in things we've talked about are heart stents. Now, it is very clear, based on several huge, well-done studies, that when you put a stent in somebody's heart, when they're not actively having a heart attack, then in the vast majority of time, that stent is worthless to damaging. Actually causes more harm than good. There are exceptions. For instance, if someone has a really weak heart and it keeps going into congestive heart failure, it might help that person. If someone cannot breathe at all when they're walking, it might help that person. But if you're talking about someone who just doesn't have symptoms at all, which is where most stents are put in, or someone who has chest pain, which is where the rest of most stents are put in, doesn't help. Medical reversal. They used to think that stents were life-saving. Studies done, turns out stents are useless. A lot of procedures. Another famous procedure like that is with the knees. If you put a scope, if an orthopedic doctor puts a scope in your knee to try to fix your arthritis, in fact, it doesn't help. But they've gone even farther than that. It used to be felt that if you tore your cartilage and you put a scope in your knee and fixed up the cartilage, then you'd get better. It turns out they did a study, a great study. It was the same kind of study as a stent study, where half the people got a scope put in to fix the cartilage, and the other half got a scope put in and did nothing. And the patients didn't know which one they had. And just as many people got better with the fake scope as with the real scope. So, and both groups got better, amazingly. Placebo, even with that, helped, just like it does with stents. Another one called kyphoplasty. Kyphoplasty is something where if you get a compression fracture or a squishing of your back, and we talked about this when we talked about osteoporosis, they could put a needle in and inject cement into that spine and make it bigger. And that is the treatment of choice. I've had patients who get this done who are instantly better. Well, again, they did a sham trial on it, where half the people got the cement and half the people got the needle in and no cement, and just as many got better in both groups. And amazingly, a lot of people in the group who got the sham procedure got better. So when I tell my patients, you know, kyphoplasty doesn't work, some of them say to me, well, sorry to say it, but it does because it worked for me. But again, there's that placebo effect, which is powerful, beyond explanation, how you could actually get a fake needle in your back and your back pain that had been laying you out for weeks suddenly gets better. So these are medical reversals. So why does this happen? Because the reason it happens with such things as stents and surgery for the knee and surgery for the back, and for certain drugs that have been shown, like calcium, which is an over-the-counter, or estrogen replacement therapy, which used to be the be-all and end-all. You had to give it to everyone. And then studies came out, and now you couldn't give it to anyone. I mean, that's the kind of stuff that happens. In the old days, when people had congestive heart failure or a weak heart, if we gave them a drug called a beta blocker, we were considered almost on the verge of malpractice because that would kill them. Because biologically, it made no sense to do it. Then studies were done and showed that actually, in congestive heart failure, if you give a beta blocker, people live a lot longer. Medical reversal, kind of a different kind of one. This medical reversal, initially the drug was found not to work, and now it's found to be standard of care. Now it's medical malpractice not to do it. So why do these happen? One reason is the original studies done are terrible. Some of them are just studies that should not be done to definitively say whether something works. They're an initial study just to test the waters a little bit before the big study comes. But everyone making a lot of money from getting these things right, to do these scopes and to do these stents and to put needles in back. A lot of money made, so they jump right in the original study. Another reason is that the statistics they use are not good. We've talked about that. They use relative numbers. So they say, well, 50% of people who get this needle in their back get better. Well, 50% can mean 1 out of 1,000 get better. And then when the next study is done, they have a slightly different patient group. So now 1 out of 1,000 get worse. Not a big swing, right? It went from 1 out of 1,000 get better to 1 out of 1,000 get worse. Not a big swing, but in percentages, now they say 50% get worse. So when they use these fake numbers, it looks really bad. The problem with medical reversals is multifold. Number one is we are basing a lot of what we do on faulty information. And a lot of doctors I see cling to that data and say, you have to do this, you have to do that. There is virtually no medical intervention out there. Now, I'm trying to think of any. Certainly you should get childhood immunizations. There are very few medical interventions other than treating wildly out of control diabetes where you definitely will get better if you take this in a meaningful way. At best, I always think of cholesterol, giving cholesterol medicine, statins, to people at high risk of heart disease, for sure helps those people get better. But how many people does it help? 4%. 4% of people. Now, you could say that is pretty amazing if you look at it over the population. That's a lot of people whose lives you're saving. But for you as an individual making a decision whether to take cholesterol medicine, 4% is a pretty small number. Because a lot of people will say, well, 90%, 96% of people don't get a benefit. I'm not taking that. That's not a medical reversal. But my point is that even among the best studies, of which that is, the amount of people that are helped is usually very tiny. So when we do a study that shows benefit, it often is such a small benefit that it's very easy to do a study and reverse it. So we should not be clinging to these medical interventions and saying they are all life-saving. We should be honest with our patients, and as patients, you should go in there and say, really, doc, if I get this surgery for my back, what's the chances I'm actually going to get better in a meaningful way? If I take this medicine for dementia, am I really going to get better in a meaningful way? If anyone tells you yes, you should run out of that office as fast as you can. I've told you, dementia medicines, nobody gets better. It's placebo. Placebo gets better. A lot of placebo effect. But, they don't actually get better in any meaningful way. And there'll be a medical reversal on dementia medicines that show that none of them work. That's just around the corner. As soon as a newer, more expensive one comes out, that's when usually the old ones are found not to work. It's somehow coincidental. So that's one problem with them. People are getting a lot of treatments, tests, medicines, procedures that don't work, and doctors are pushing them because they're money makers or because they believe in them, and patients are exposed to a lot of harm that way. A lot of these things cause harm. The second thing is, it really, other than the cost to the system, which is huge, it really makes people skeptical about the whole medical system. I mean, when one day you're told that you have to get a stent or you're going to die, and then the next year you hear that stents are worthless, you start to really question the medical system. You say, who could I trust? And you start to think you can't trust anyone, and you give up on the medical system. So when you really need us, for some reason, when, for instance, your appendix ruptures, you say, well, maybe I won't go. So the lack of trust in the medical system is because we as doctors and also the researchers who provide us with data are really pulling a fast one over everybody. Mostly to make money, but also to publish articles, to get academic success. There's a lot of reasons why all this stuff is going on. Hey, hope you like the podcast. We'll be back next week. I'm going to give you some information. If you want to check the website, if you want to email me, if you got your own stories, let's talk about it. See you next week.